Welcome to long-term care, where we focus on providing the best care for our patients. Today, we will be discussing mastering nursing documentation, a practical guide for every level of nurse. Let's begin with Module 1, Introduction to Nursing Documentation. First, let's go over the learning objectives for this module. By the end of this module, you will be able to define nursing documentation, identify key characteristics, differentiate between subjective and objective language, describe responsibilities, recognize risks, and apply best practices. This module lays the foundation for mastering nursing documentation, crucial for delivering high-quality care, improving patient outcomes, and ensuring compliance with healthcare standards. Now, let's dive into nursing documentation. Nursing documentation is a comprehensive record of all aspects of patient care provided by nurses, encompassing assessments, interventions, patient responses, and other relevant clinical information. Next, we will discuss the purpose of nursing documentation. One key purpose is communication, facilitating effective information exchange among healthcare providers to ensure continuity of care. Nursing documentation also serves as a legal record that provides evidence of the care provided. It supports quality improvement initiatives by providing data for evaluating care outcomes. Additionally, it justifies billing and reimbursement by documenting the services provided. Finally, it contributes to clinical research and education by offering comprehensive patient care data. The National Council of State Boards of Nursing highlights that nurses are responsible for documenting nursing care accurately and timely, which is crucial for patient safety and quality care. In summary, nursing documentation is a fundamental component of professional nursing practice, ensuring effective communication, legal accountability, quality improvement, and optimal patient care outcomes. Now, let's explore the legal and professional implications of nursing documentation. Understanding the legal and professional implications is essential for every nurse. Nursing documentation is considered a legal record and can be used as evidence in court during malpractice claims or other legal proceedings. Poor or incomplete documentation can imply negligence. Documentation provides evidence that nurses followed established protocols, policies, and procedures, ensuring they meet the standards of care expected in their role. Regulatory bodies such as the Centers for Medicare and Medicaid Services, CMS, and the Joint Commission, TJC, require specific documentation practices to ensure compliance with healthcare standards. Failure to maintain proper documentation can lead to penalties, loss of accreditation, or reduced reimbursement for healthcare facilities. Patients have a legal right to access their medical records. Therefore, nursing documentation must be clear, respectful, and objective to protect the nurse and the facility from claims of defamation or violation of privacy. Documentation must comply with HIPAA regulations to protect patient confidentiality. Understanding the legal and professional implications of nursing documentation is crucial for maintaining compliance and ensuring high-quality patient care. Now, let's delve into the professional implications of nursing documentation and how it impacts patient care and professional responsibility. Nursing documentation demonstrates accountability for patient care. It reflects the nurse's critical thinking, decision-making, and adherence to ethical and professional standards. Proper documentation supports the nurse's professional integrity and credibility. Accurate documentation ensures continuity of care by enabling other healthcare providers to understand the patient's current condition, treatment plan, and progress. Poor documentation can lead to errors in treatment, resulting in harm to the patient and professional consequences for the nurse. Nursing documentation is often used in performance evaluations, audits, and peer reviews. Thorough and accurate records demonstrate a nurse's competence and attention to detail. Consistently poor documentation can result in disciplinary action by employers or state boards of nursing. State boards of nursing can investigate complaints related to inadequate or falsified documentation. Nurses found guilty of documentation errors or omissions may face penalties, including suspension or revocation of their license. Let's explore 4 common documentation pitfalls and their potential consequences in nursing practice. Gaps in the record may imply negligence or poor care, leading to potential legal and professional repercussions. Missing critical information can result in missed care or errors in treatment, leading to harm and liability. Falsifying records is considered a serious ethical and legal violation that can result in license revocation and legal prosecution. Using subjective language can lead to misinterpretation and affect patient trust or legal outcomes. It is important to keep documentation objective and clear. Now, let's discuss the best practices to mitigate legal and professional risks associated with nursing documentation. Ensure entries are made as soon as possible after an event occurs to maintain accuracy and reliability. Stick to factual, objective observations and avoid personal opinions or assumptions in your documentation. Follow facility policies and use standardized formats or templates when possible to ensure consistency. If using handwritten notes, ensure they are legible. In electronic documentation, use clear and concise language. If an error occurs, follow proper procedures for correcting it, such as single-line strike-throughs for handwritten records or system correction protocols for electronic health records. Adhere to privacy laws and policies, ensuring patient information is shared only with authorized individuals. Welcome to our presentation on the different levels of documentation responsibilities in nursing. Today, we'll explore the various roles and their specific documentation duties. Licensed practical nurses, LPNs, and licensed vocational nurses, LVNs, focus on patient assessments, medication administration, treatments, and reporting to RNs. Their documentation ensures continuity of care and compliance with protocols. Registered nurses, RNs, have a broader scope, including comprehensive assessments, care plans, interventions, patient education, and incident reports. Their documentation supports clinical decision-making and legal accountability. Advanced Practice Registered Nurses, APRNs, document advanced assessments, prescriptions, diagnoses, and treatment plans. Their detailed records support complex decision-making and advanced practice services. Directors of Nursing, DONs, handle administrative documentation, incident reports, regulatory compliance, and staff education. Their documentation maintains operational oversight and supports regulatory compliance. Nurse educators document educational sessions, competency assessments, and policy updates. Their records ensure ongoing staff development and compliance with educational requirements. Quality assurance teams document incident tracking, quality metrics, and root cause analyses. Their documentation aims to improve patient safety and ensure continuous quality improvement in healthcare delivery. In conclusion, each level of nursing practice has specific documentation responsibilities that contribute to the overall quality, safety, and continuity of patient care. Understanding these responsibilities ensures that nurses document appropriately within their scope of practice, support interdisciplinary communication, and comply with legal and regulatory standards. Here are the sources that informed our presentation, including guidelines from the American Nurses Association and the National Council of State Boards of Nursing. Now, let's test your knowledge with a quiz on nursing documentation. Answer the following questions to see how much you've learned. Review the questions carefully and choose the best answer. This will help reinforce your understanding of the documentation responsibilities in nursing. Here are the correct answers to the quiz. Check your responses to see how well you understood the material. Thank you for participating in our presentation. If you have any questions, feel free to ask now. Welcome to Long-Term Care. We hope this presentation has been informative and helpful in understanding nursing documentation responsibilities.